Hi everyone, welcome back to Minute with Miles. I haven't been able to update the series as much recently because I've been so busy, and one of the projects I've been working on has to do with the Journal of Dietary Supplements. So this is a peer-reviewed research journal, and they recently invited authors to submit articles on cannabinoids, on hemp, on CBD. So Dr. Osvaldo Marinati and myself got published in the journal our commentary on differentiating full-spectrum plant hemp extracts from CBD isolates and what the potential implications of that might be from a scientific context, from a regulatory or policy-based context. And on top of that, CV Sciences also sponsored research or was the subject of research in a couple of other articles, and that includes a randomized controlled trial, the gold standard in clinical research, showing that PlusCBD compared to placebo was safe and effective, and a 2-year-long adverse event reporting study further confirming some of the safety of this ingredient. And on top of that, there are a number of other studies that were published in the special issue on safety, microbiome, hemp, CBD. It's really quite an exciting issue. So with me today, I went and interviewed Dr. Taylor Wallace, is the editor-in-chief of the Journal of Dietary Supplements, and we talk everything hemp, CBD, the FDA, we go into dietary supplement regulation, we go into some chemistry, we go into how to stay healthy. We have sort of this long, in-depth, high-level discussion on a number of topics related to this exciting issue. So if you're new to the channel, make sure that you hit like and subscribe to keep updated with all the cool stuff that's going on here. Thanks for watching. Check this out. Okay, so I guess we'll just get started. My name is Miles Sarill. I am National Educator for CV Sciences and also one of the co-authors of a recent publication in the Journal of Dietary Supplements special issue on the cannabinoids. And it is my pleasure today to be having a discussion about cannabinoids with Dr. Taylor Wallace. He is the principal and CEO of Think Healthy Group and an adjunct professor in the Department of Nutrition and Food Studies at George Mason University, editor-in-chief of the Journal of Dietary Supplements, editor of 6 academic textbooks, author of over 50 peer-reviewed manuscripts and book chapters, operates a popular nutrition blog, drtaylorwallace.com, regular guest commentator on NBC4 Washington and the Dr. Oz Show. I mean, doctor, it sounds like your resume just goes on and on and on. So thank you so much for taking the time out of your busy schedule to speak with me about this important subject.
Sometimes I think I'm going to lose my own mind. Maybe I need some CBD supplement for stress and anxiety.
I mean, I think it's sort of incredible, right? That CBD, over the course of 2 years now, has gone from illegal to basically mainstream, right? Like you can find CBD kiosks at mainstream malls, in gas stations. This ingredient has just exploded in terms of popularity. And at the same time, I should add, in some ways, in many ways, it is still technically illegal. And that's something that confuses a lot of people. That yes, the Farm Bill passed in December 2018, and that liberated the hemp plant from the Controlled Substances Act, basically defining it as saying, this is a crop with low THC content. And then people sort of took that to mean, well, CBD, I can put that in my brownies now, I can put that in bath bombs and soap, you know, I'll do anything with it, right? And so, no, the FDA still ultimately governs what can happen to CBD products, right? You know, in terms of it as a food additive, as a supplement. So given all that I just said, what was your intention in kind of inviting authors to submit manuscripts for a special issue on cannabinoids in supplements?
Right. So, you know, I work in Washington, D.C. Like you said, I'm at George Mason University, which is right outside of the District of Columbia. And, you know, I work in the policy space quite often, do a lot of research to inform better policies. And like you said, consumers are crazy about CBD. We see a large amount of consumers who have tried the product, who take the product, who attest to the product, who don't attest to the product. And FDA is having a really hard time with this because they have to decide ultimately how to regulate these products. And that's a tremendous task for the agency to take on. Now, they've published an interim kind of report saying that they're considering regulation of CBD as dietary supplements. There's obviously a ton of dietary supplement products already currently on the market. But, you know, the agency says over and over again that they are concerned with the safety. There's large quantities of people taking these types of supplements. Is there a risk-benefit ratio? And what is that ratio? And so I think that's kind of what we sought to determine in this special edition. We wanted articles that really looked at the safety of CBD, its long-term effects on health outcomes, and we wanted the opinions of, you know, industry, academia, government when it came to how scientists think that these products should be regulated. And a lot of times we think, you know, it's all about the safety data, but, you know, when we make policy, we also have to carefully consider lots of consumers really want to use these products and believe in them. And so FDA has to really take all of this into consideration. Now, for those of you listening, there has been a significant amount of science related to very high doses of CBD, 1,500 milligrams a day, 3,000 milligrams a day, that are used to treat childhood epilepsy, certain types of childhood epilepsy. But that doesn't necessarily reflect what maybe a dietary supplement would contain. You're talking dietary supplements have anywhere from, you know, maybe 5 to 50 milligrams compared to 3,000. You know, toxicity is always with the dose. So
the dose determines the poison, right?
Right. And so I think it's important for us to have this special edition to really look at CBD as most mainstream people are taking CBD as a dietary supplement. And so we did just that. And I think we have some data that, well, I know has been handed over to the FDA that they're considering. And I think it's really, really caused a good scientific conversation to happen within the research community.
And that's so important, right? To stimulate these ideas, to get the agency's eyes on the manuscripts, because they, as you pointed out, they have a Herculean task of regulating this ingredient that everybody wants to be a part of. And some of the challenges with that are, there are a lot of folks, you know, I'm not saying this is everyone, but there are, you know, upwards of 3,500 different CBD companies out there. And some folks are just going to, you know, want to be growing their hemp in their backyard. Sometimes it's hot hemp that has too much THC, and then they're extracting it with who knows what in their bathtub and then selling it, you know, across the street, right? It's like, how does the agency, you know, I mean, they do have the guidelines in terms of enforcing good manufacturing practices. It seems as though we need more smart regulation, though, to make sure that CBD is being produced in a respectful manner. So certainly getting more information about its safety as well from academia and industries such as CV Sciences does make a lot of sense.
Well, and, you know, I'll say that, you know, you're always in a better scenario when it comes to safety if FDA regulates. So right now, like you said, we're absent of a lot of regulations, which, you know, really opens the floodgates for products that are adulterated, that, you know, maybe aren't as high of quality as other products. And so just with FDA regulating, despite how they choose to regulate, regulation often, you know, produces safer products that are more high quality for consumers.
So that's incredibly important. So, you know, one of the reasons that I'm specifically talking to today about this subject is the fact that CV Sciences was involved with, or was the subject of, a couple of studies that got published in the Journal of Dietary Supplements. And I do want to talk about those, but I actually first want to ask you, what other studies that you saw that were submitted or that got published really caught your attention and made you go kind of, wow, this is really a contribution to the literature?
Right. So, you know, obviously, you know, we had a set of commentaries, you know, from, you know, industry groups and academics and even government folks that or former government folks that, gave a very broad view of how different scientists think CBD should be regulated. And, that is a really contentious issue that I think needed to be laid out on the table for everybody to see so that the best regulations can be developed based upon scientific consensus. There's three really neat findings that I took from the journal or the special issue in the journal. First, the amount of CBD products that are currently on the market that are either misbranded or adulterated. And we have a study from a group of researchers in Mississippi that found a lot of CBD products out there actually contain THC levels that are higher than the legal limit and could cause you to test positive, on a drug test, which, jeopardizes your employment status if you're, consuming these products, not knowing that they contain a certain amount of THC. So that was an interesting finding to me. The other two interesting findings, one was the study that CV Sciences sponsored. And I, for the audience, I have no conflicts of interest with CV Sciences, but it was a great study. I always encourage the industry to sponsor safety research on their products and really commend companies that do that. And I think we need to see a lot more of that. And so, this study had a couple interesting findings. One, it really showed that 15 milligrams per day that, is present in your products, but also other, CBD products on the market is safe when it comes to liver toxicity and elevation of some of the enzymes that we've seen in other human clinical trials that are drug studies of those 3,000 milligram doses versus what would naturally, or what not naturally, but would be typical of a dietary supplement. So I thought that was a really nice finding that would really help inform the FDA when it starts to make regulation around these types of dietary supplements. The other thing is the whole sleep. People in the study they slept longer, they had better sleep, or at least they perceived they had better sleep. And so I think that kind of plays into the whole, neurological aspects of CBD when it comes to, things like anxiety. Getting a good night's sleep, we know, is really important. That I think was a really nice thing. And to my knowledge, that is the first clinical trial that's looked at a dose that's representative of what you would consume as a dietary supplement and not as, a drug, at least in the US. The final thing that I thought was really interesting about the special edition is a separate study that looked at CBD's effects on the microbiome.
Yes, yep, that was a cool one.
Yeah, and you see we don't really know a lot about the microbiome. We like to talk about the microbiome because it's new, it's exciting, but we did show in this special edition that CBD has the ability to alter the microbiome. Now, whether that is beneficial or not, is still in my mind a little bit TBD, right? Because we still need a lot more research on the microbiome to show whether, certain types of microbes in our gut are beneficial or detrimental. But I was really surprised that such a low dose of a compound like CBD could actually alter the microbiome. And I think that's something we should consider in future studies.
Right, and that was Dr. Igor Kotorbash's study, if I'm pronouncing his name correctly. But yeah, I was really excited by that study too. And I kind of love the idea. I mean, also think about that probiotics have also gained tremendous popularity, and that there are a lot of very good studies on taking probiotic supplements. So I kind of like the idea that perhaps one of the reasons why people are reporting benefit with hemp CBD might be that maybe it has some impact on the microbiome. And then there's all these studies showing that if you remodel the microbiome, that can have whole human health effects. So actually going back to one of the studies that CV Science's PlusCBD was the focus of, the randomized controlled trial that you were mentioning, whereby people actually slept better when they were taking the CBD hemp extract. One of the other findings was that compared to placebo, those taking the 15 milligrams of CBD within that hemp extract actually saw improvements in their HDL cholesterol.
Right.
And I mean, I think that that's a pretty fantastic finding. And I can't help but think in my head, like, well, wait a minute, I wonder if some of those metabolic changes might be driven in part from changes in the gut, right? Just to sort of glue two ideas together.
Well, and you know, my lab was one of the first labs to publish, or at least what I would consider to be a causal effect of the microbiome on health. And, you know, we took what are called bacteriophages, or bacteria-specific viruses. And we used bacteria-specific viruses that target E. coli. So they don't have the capability to infect even a closely related bacteria. It has to have a certain sequence on the bacterial cell wall for this virus to infect.
Right.
And so basically we knocked out a lot of the pathogenic, or all of the pathogenic E. coli in among individuals who had GI distress. And surprisingly, what we found is that if you looked at really, really obese individuals or those with metabolic syndrome, we lowered their cholesterol just by altering the microbiome. Now, this is, you know, a sub-analysis of a very small group of individuals and needs to be replicated. But it goes to show that just one species of bacteria can actually have pretty significant effects on things like cholesterol levels. And we know that food directly affects, you know, the microbiome. And so I think kind of coupling that with what I've seen in this study, you know, and you also see in rat studies that CBD, now the rat studies had a much higher dose, but you also saw that it raised HDL cholesterol in those rodent studies. So I think there's a story that's not been fully told about CBD in relation to some of these markers like HDL cholesterol and even blood pressure.
Right. And I don't want to go too far in one tangent or another, but, you know, I also can't help but think about the relationship between food and our endocannabinoid system, which is still very much, you know, being researched right now. This is a relatively new system in terms of our human understanding of it. You know, it was only discovered in the early 90s. CBD, in part, might work through regulating some of the enzymes or receptors of endocannabinoid system. But endocannabinoids appear to impact, you know, brain state, right? It's not just the effect of feeling high, it controls metabolism and immune function. So that might be in part explaining, again, why CBD might impact a number of different, you know, structure function related claims: stress, sleep, metabolism, etc.
You know, that would be really interesting if you have extra blood samples from your study to look at its effects on some of these inflammatory cytokines and chemokines that play into building, you know, stronger immune system function.
I mean, stronger immune system function is on everybody's mind right now.
Right.
You know, and of course, stress also shuts down the immune system so that you can run for your life. They're kind of diametrically opposed. So, you know, even if it doesn't regulate the cytokines or other immune factors, maybe there is still some rationale for using a botanical such as hemp prophylactically to balance a healthy stress response.
Right. Well, and I think you see that across the board with nutrition, being nutrient sufficient, having a high intake of, you know, plant bioactives in general seems to decrease stress and oxidative stress in the body and improve some of that, those immune markers.
Right. Cool. So there was the randomized controlled trial, and that was one of the first double-blind studies on a hemp extract containing moderate doses of CBD, rather than, you know, the thousands that were used in the prescription drug epilepsy studies. And then another study that was based around CV Science's PlusCBD was kind of a longitudinal analysis of adverse events associated with use. And it was actually quite remarkable, in my opinion, that you had almost 5 million products sold and only less than 1,500 potential adverse events associated with that. So I think that that's the type of data that FDA is going to need in order to say, yeah, this is a supplement, right?
Yeah. Well, and that data comes from the FDA's adverse event reporting system, and also has its ups and downs. I think one of the things that as a scientist, I should say about, that particular data set is that an adverse event is basically, how it's labeled. So you see a lot of times with some of these data sets where physicians or consumers, self-report adverse events to, either FDA or the poison control centers, things like that. We see a lot of things like with energy drinks that a lot of adverse events are mom calls into the poison control center because her 3-year-old child took a sip of Red Bull, and that's documented as an adverse event. Even though nothing happened, it's documented as a poisoning. So you have to kind of really get into that data and tease it out to find serious adverse events. Now, the FDA system is a little bit different in that companies, often have to report that data, and they often ascertain, was it the kid taking a sip of the Red Bull can and nothing happened, or did this product actually send somebody to the hospital? Right. And like you said, I think that the incidence was really low, 1,500 events, but I actually think the ones that I would consider a serious event are probably even less.
Yeah, I think because Stephen Schmitz, the author, did tease out a lot of the data and found that most of the adverse events were pretty minor, at worst a rash, headache, maybe nausea, what might be typical of any even well-made dietary supplement. There were 2, I think, reported serious adverse events, but the people that were associated with them were already pretty dealing with like a chronic issue in the hospital already. So it has to be reported that way. But I think it's another way to remind people, and I mean, of course, correct me if I'm wrong, but it appears to me as another way to remind regulators or consumers that there are appropriate ways of reporting about products such as CBD and assessing, is this safe as a dietary supplement? Might we consider someday this could be used as a food ingredient based on sort of the assessment of millions of products and how people responded to it?
Well, and that's another reason that FDA needs to come out with regulations on CBD products, because I think, you all use data from, I believe it was your products, right, that was sent in, the adverse event data from your products. You all are a very good company that tries to do the right thing. There are some mom and pop shops out there that don't necessarily monitor the adverse events that their products cause and look at that data on a regular basis, and regulation by FDA forces them to do that. And I think that's a really important piece of the puzzle that a lot of people miss when we talk about why these products need to be regulated.
Right, and so this actually is kind of a nice way to bring us in the conversation to the piece that I was co-author for, not to toot my horn, but I was basically penning an opinion in the journal on how it could be that the FDA could look at CBD and regulate it as a supplement. And one of the big challenges right now is that the FDA already considers CBD to be a drug because they Epidiolex, as the drug produced by GW Pharma for rare forms of severe childhood epilepsy, Dravet syndrome, Lennox-Gastaut, etc., already went through the drug approval process. And the current FDA setup is, well, if this is a drug and you weren't selling a supplement before this, then, you can't make this a supplement at all. And the reason, of course, why CBD was not sold as a lawful supplement before Epidiolex became a drug is because of the fact that it was considered a controlled substance, right, because of our country's kind of history surrounding cannabis in general.
Right.
So it's a little bit of a catch-22 for responsible industry players that want to be able to produce this. And so I basically argued, along with my colleague, Dr. Osvaldo Marinati, basically said, look, the composition of your material should determine how it's regulated. If it is from high THC cannabis, that's a dispensary item that gets left to the states. If you're taking the whole hemp plant and it's agricultural food fiber hemp, you're extracting the whole thing, and it's only, it caps out at 25% CBD, and there's all this other botanical material and phytonutrients in that extract. That is a botanical supplement that is distinct from just an isolated CBD molecule, i.e. Epidiolex is 99% CBD. So I think that that's a pretty easy, just chemical way for the agency to say, this is different from this, right? I mean, does that make any sense for you?
Well, yeah, and the other thing that I will say, and the next project that the Journal of Dietary Supplements editorial board has decided it will take on is we're going to be doing a special edition that looks specifically at dietary supplement regulations. Because dietary supplement regulations were first introduced when there were about 5,000 dietary supplements on the market in the US in 1994. Today, there's over 100,000 products on the market. And, things have really changed since 1994. Technology has given us the capability to create products that we would have never thought about in 1994. So I think that's something that's coming. And, I think that regulations have to be like science. They constantly have to evolve based on the science. And I think this is an area where regulations, unfortunately, need to evolve.
Right. I mean, I'm trying to just provide an equivalency between CBD isolates and full spectrum extracts, the same way that the agency has already sort of said, well, you can have omega-3 in cod liver oil supplements, and also here's Vascepa, here's Lavazza, which are prescription omega-3 products for this certain disease. So there already does appear to be some type of lawful pathway for an ingredient to have it both ways. And so I think it's important for the agency to consider that there might be some way in which CBD can fall into a similar legal umbrella.
Right.
I think another big step that the agency could take is to model some of the recent procedures or rulings by the Australian counterpart to FDA, which is the Therapeutic Goods Administration. And I think it was a month or two ago, TGA came out and said, CBD can be sold over the counter, but we're limiting the amount of servings in the package, and we're limiting the dosage based on their safety data or the data that they've collected. So, I mean, I don't know what your thoughts are on that in terms of potential regulation.
Well, I think it's always good to look internationally what other people are doing, because again, you can pull a lot of safety data and, compile a lot of data that looks at, how the consumer uses the products, what influence regulation does have on the products. I think probably you don't see what I call the wild, wild west side of the supplement industry so much in places like the EU and Australia, because their regulations have evolved more so than ours have. And so I think this is something that we constantly have to take a look at. And the climate in Australia is very different than the climate in the US. So I think there's similarities, and I think there's findings that there's data we can use from Australia, but I do think we have to also, recognize that, we're a, independent, culture here in the US, and how we purchase products and go about our daily lives are sometimes, different, and, that's okay.
Right. Yeah, the different ways in which law applies to people, different products, different people, right? That being said, of course, the goal is to, put forward policy that is somewhat rooted in science. And that's why I really appreciated, I think you made some mention of this earlier, that when it appeared that when my article came out or was published in the journal, it came along side by side with another commentary with some pretty big names associated with it. Dr. Larry Walker, Mahmoud El-Sohi, and Ikhlas Khan, and Igor Kotorbash, and others, and I apologize if I skipped your name, really came out and said, look, there should be a pathway. These are the concerns. Here's why CBD might not be safe if you're using these mega doses or use them under a doctor's care. And I kind of like their suggestion, which was a little bit more perhaps controlled than what I was suggesting, that perhaps manufacturers need to register with the FDA, that the FDA would sort of have a trusted partners kind of list of companies that they know are absolutely following the rules, have done generally recognized as safety research, so on and so forth.
Well, we've talked a lot about that just with dietary supplements in general, having more of a registry, because right now one of the issues in the supplement industry, at least in my mind, is that FDA doesn't know what's on the market. And so how can FDA control whether products are safe or not when they don't know what's on the market? And so I think having some kind of register with the agency is a really smart move to help protect consumers, and it's an easy win-win.
Right. So, of course, we don't have that registry yet. We don't have that type of regulation yet. I mean, what do you tell somebody, a consumer that is in the mall and they're holding a CBD product that they're, that's at the kiosk or whatever? I mean, what do you tell that person that's looking to find a quality CBD product? Now, I'm not looking for an endorsement of anyone, just what your opinion is.
I was asked to write a blog about CBD not too long ago. And, people always ask me, which products do you recommend? And typically on my blog, I try to stay away from recommending any particular brand, but I actually have to give it to CV Sciences. I believe that, the companies that invest in the research are the ones that should be, get the benefit of saying, my product's tested, it's safe, it's quality, and here's the peer-reviewed research in the journal to show that. When you walk into a mall, I mean, there are thousands of products, and I think you look at and even more on Amazon and some of these online retailers, if you look at the study that came out of Mississippi, I mean, there were, 75% or more of those products were adulterated and not high quality. And so, there's a big chance if you walk into the mall or you go on Amazon that you're going to find one of those products. And, the last thing we want to happen is somebody to test positive on a drug test because, they had a sore back and they thought they'd try the CBD at the mall. We want to prevent that first and foremost. And so, again, I think that's why regulation is so important and why FDA has to really make some hard decisions in a very short time frame.
Yeah, it's about consumer safety, right? But thank you for saying that about CV Sciences. And I'll just point out that there are a bunch of other companies that do invest in peer-reviewed research too. And I always encourage people, when I see other CBD manufacturers at trade shows and stuff, I say, where's the peer-reviewed science, right? I think that it's such an important step to invest some of the money in this pretty large industry now back into data that will help consumers and help parents and help regulators, so on and so forth.
Yeah, it's oftentimes, as scientists, we get hit fairly hard. It actually doesn't have a good public perception to have research that is funded directly by the industry. But, industry makes products, consumers consume products. And so in my mind, we need to know the safety of these products, especially if they're widely consumed by, people of different age groups. I mean, you have my dad that's using CBD supplements to self-treat Parkinson's disease. Mm-hmm. And, I am more comfortable with an older parent doing that, knowing that he's using a product that has been extensively studied for its effects on safety. And I think a lot of people feel that way. And I think a lot of times we get some criticism of these types of studies that's, in some way unfair because government doesn't fund these types of studies, right? So if industry doesn't fund them, they don't get funded, and they can have a very large impact on public health. I actually think it's the responsibility of the industry to support research on their products. And I think that, I never try to discredit anybody who takes industry funding for that very reason.
I mean, and it must be difficult for, I haven't been in the laboratory for a couple of years, but funding can be sparse for, if it is coming from NIH or another government agency. It can be hard to secure a grant in order to study what you want to be able to study. So sometimes it appears as though industry support is necessary to even do the most basic research, right?
Yeah. People don't realize that only about 3% of NIH's budget actually goes to nutrition research, which is kind of sad given the largest threat to public health in my mind, right? These days is obesity. I mean, you link that to pretty much every chronic disease that, we see.
Right.
And NIH does all this research for drug compounds that they hand over to drug companies that sell these compounds for, way too much, that are taxpayer funded, that, taxpayers paid to develop them.
Right.
And we put almost nothing into looking at the underlying problem and what's causing, all these, heart disease, cancers, age-related cognitive decline, these types of obesity-related chronic diseases. It's really sad, and it's a change I've written about in USA Today. And I think that one of the most critical things we can do in nutrition science, whether it be for CBD or any other type of food, is to establish a National Institute of Nutrition within the National Institutes of Health that focuses specifically on nutrition and prevention research.
That sounds like a great idea. I'm all in for it. That sounds wonderful. So, I mean, you mentioned that your father takes CBD. I mean, do you take CBD? Have you used it for anything in particular?
So I actually don't take CBD. I used CBD one time when I was playing in a kickball tournament, and I pulled a muscle during one of the preliminary rounds. I'm the pitcher on the team. Mm-hmm. And I went out and bought some CBD supplements and took them. I think they had a little bit of an effect, but could have been a placebo effect too. Who knows? Once you get out there and you kind of re-stretch yourself out, it's you need those randomized double-blind placebo-controlled trials, which you sponsored, to really give you the answer. But like everybody else, I'm a consumer, and so a new exciting product comes along, and I want to try it. I take supplements, and but no, currently I don't take CBD.
So then, if you don't mind me asking, what supplements are part of your daily regimen?
Right. So I take a multivitamin. I'm a very firm believer in multivitamins. And, the Physicians Health 2 study, one of our editorial board members, Dr. Howard Sesso, is the principal investigator on. It's a 16,000 person randomized trial that looked at multivitamin use for a period of, I think it was 8 years. And they found about a 9% reduction in cancer incidence by taking a daily multivitamin. So, I kind of think of multivitamins as a nutrition insurance plan. I also take dietary fiber. Mm-hmm. I take my Metamucil every day. People laugh at me all the time. My friends come over to the house, but it's actually one of the things as a younger person, that's approaching my 40s that you can do for yourself that might have long-term, effects at least in my mind.
Goes back to the microbiome, right?
Right. And cholesterol levels that can be influenced by the microbiome, which is heavily influenced by soluble fibers. And so I take that. Ever since COVID-19 started, I've taken a lot of magnesium. I do a lot of research on magnesium, and it's become very apparent to me that the cytokine storm is very involved with subclinical magnesium deficiency, or just maybe not deficiency, but insufficiency. So just being slightly, low in magnesium can really make you vulnerable to that cytokine storm that can happen if you can.
It's involved with 400 different enzymatic pathways, right? And I mean, I've seen the graphs of how over the last couple of decades, Americans' magnesium intake has just sort of plummeted over time.
Well, magnesium's really interesting because it impacts the renin-angiotensin system, which is, the ACE2 receptor is part of, which is the main, way receptor for the virus to enter your body. It's also, a lot of people don't realize, and I take vitamin D as well as part of my multivitamin. Magnesium activates vitamin D receptors in your body. And so a lot of people don't realize that you can take a lot of supplemental like vitamin D, but if you're not sufficient in magnesium, a lot of times your blood levels won't rise.
Right.
The same happens in the ICU with potassium. You first have to replete magnesium, or else if you try to replete potassium, which is low in 98% of patients with COVID-19 that are in the ICU, at least in data we're seeing from China. And so magnesium is involved in a lot of these different regulatory pathways in the body. The last way is with the production of IL-6, which is a big drug target for COVID-19.
Right.
Magnesium seems to be able to effectively inhibit IL-6. And, this is compiling studies that are non-COVID patients, but it seems to be involved in IL-6 production. And IL-6 kind of starts the whole cytokine storm. It really turns up C-reactive protein and the other interleukins and is in part responsible for that cytokine storm that we're trying to control with drug discovery right now.
Right. And of course,
super important.
Sorry, say that again.
I just said magnesium is super important.
I completely agree with you. And I just wanted to add that, and then some of the botanicals on top of that might also limit some of the inflammatory damage kicked off by IL-6, anything that inhibits the transcription factor NF-kappa B, right? And that extends to curcumin, that extends to, some other botanicals, some of the flavonoids, but also CBD might also be an inhibitor, at least in some of these in vitro studies of some of these major inflammatory pathways that does cause immune overactivation. Right. I don't want to say cytokine storm because we're not at the point where we can say that CBD is a treatment for anything outside of Dravet syndrome. But, you look at all this in vitro research and you say, okay, that might be doing something.
Right. Well, I think it calls for more research. And one of the things that I've been trying to move the Journal of Dietary Supplements towards is more clinical research. Because a lot of times we do these, studies in rats. We use a amount of a certain compound that is way far beyond what's physiologically relevant. I mean, if you even go back to non-dietary supplement studies in the 80s where they were given enough, artificial sweeteners, that you would have to drink 20,000 Diet Cokes a day at that level. I mean, a lot of the rodent studies, suffer from they have extremely high levels. The cell line studies are the same way. You're trying to identify a mechanism, so you use this level that's extremely high, and it doesn't necessarily happen when you take a 15 milligram CBD supplement.
This from what you just said reminded me of, right? Like this is a book from the 80s on said dietary sweetener. And you're right, it's that's the challenge when in science you're looking to measure a physiological effect that gets some statistical significance, right? And then you sort of publish that. And that's not always representative of what's happening in a human for a number of different reasons. So,
it can be. I mean, with a good example is magnesium. We've started a COVID-19 study in my lab where we're going to be looking at magnesium levels in patients. And, we know a lot of the biochemistry about magnesium from rats. I mean, you can't dissect people, that's
right.
You can dissect them. You can't really not make people sign up for a clinical trial to, if you're going to remove their heart or organ, see what the magnesium or CBD does. And so that's a limitation in nutrition science. And, so I don't mean to discredit, toxicity studies or rodent studies, cell line studies, because they do have their value. But at the same time, it's why NIH needs to establish a National Institute for Nutrition and start funding human clinical work in regard to prevention research, because a lot of our recommendations are based on, rodent studies that don't translate to humans.
Mm-hmm.
So you really have to know those models and validate those models. And a lot of that research hasn't been done because there's not a lot of money in nutrition science, unfortunately.
Right. Well, we have covered so much in the last, 20, 30 minutes. I don't know how much time it's been. I just really very much enjoyed this discussion. Ever since getting the chance to publish in your journal, I'm like, I'm going to be reading all the papers that come out now in it. It's been a really, it's been a really nice experience for me overall. So, thank you again for spending this time discussing this with me. Any last thoughts just on cannabinoids in general? I think we pretty much covered all the topics.
No, I mean, I would say take a look at the special edition. There are so many, wonderful little nuggets of information in there that I think not only will help from a policy and regulatory perspective, but can also help guide consumers in their understanding of CBD and what doses are appropriate, like the quality of certain types of products. I think there's just a ton of information in the journal, and as that special edition publishes on August 1st, we'll be doing some outreach with the media and different consumer groups to kind of get that research translated down into messages that consumers can understand.
Right, that's super important. Well, Dr. Wallace, thank you so much again for this time. I really appreciate it. And, everybody go check out his website, drtaylorwallace.com. You're on Instagram, you're on Facebook, you're on all the platforms. So check that out. And thank you so much. I'll see you all next time. Take care.
Thank you.